Hello, this is Miss Hillman. This lecture is over the urinary system. It is in your A&P book, chapter 17. All right, as an introduction, um, what does what does the kidneys do for our body? They do a lot, a whole lot. Our book tells us it is the purification plant, cleaning the blood of waste materials. And what kind of waste materials are we talking about? Well, for the most part, we're thinking and talking about cellular waste. Also, excesses that our body has. The kidneys control the electrolyte and fluid balances, and they do this along with another system of our body. Anybody remember what it is? Yes, that is correct. Our lungs. So if we're in metabolic or respiratory acidosis or alkalosis, the respiratory system works hard, and so does the kidney renal system to get us back in balance. And of course, when our body cannot get us back into balance due to sickness, diseases, we have to get a medical intervention. So let's see. Also, our kidneys filter our blood. They reabsorb some of what they filter to keep our body in our homeostasis. They also secrete some ions, and they produce urine to help all of our waste products ability to leave the body. Without these important functions, death occurs within a few days. So if you've ever heard someone that's on dialysis say, I just want to stop doing this, I don't want to do this any longer, they will essentially die without this, and they should know this, but I'm sure that they do get tired of the process over time. And so of the blood that the kidneys filter, they filter about 200 quarts of blood per day. It's a lot. But it's very essential. I have a blank here for what else the kidneys do, and you should be able to fill in some thoughts. What comes to my mind is our kidneys help, and we think about our blood vessels. If they're very small, like a coffee stirrer, our blood pressure is very high. If they're like a milkshake straw and relaxed, then our blood pressure will be low. So blood pressure is something else that the kidneys do. The kidneys make secrete a hormone when our red blood cells are low. The hormone's erythropoietin. That helps our body say, hey, we got to start making some more red blood cells. So a healthy body can do that. The kidneys also, where do they send that urine to? When the kidneys make the urine, it flows down our ureters to the bladder. And then from the bladder, it flows out the urethra to be excreted. The kidneys also help synthesize vitamin D for calcium absorption and regulation of the parathyroid hormone. So lots going on with the kidneys. The kidneys are two bean-shaped organs located in the superior dorsal abdominal cavity. They filter blood and make urine. And they hold about 20% of your blood every second of the day. We have, again, the kidneys. These are the ureters that go from each kidney down to our bladder that holds our urine. There are two sphincters there. We have an internal sphincter that your brain controls, and of course, an external sphincter that we control. The bladder also has rugae, just like our stomach and our uterus. So we have the ability to hold our urine. Now, the muscles of the pelvic floor help hold urine, help hold the urine. And so as we age, the ability to use those muscles decreases. And so then we have incontinence. Also, sometimes after giving birth, women have something called stress incontinence. When they laugh or cough or sneeze, they may a little urine may leak. One way to help strengthen these muscles are the Kegel exercises, Kegal. They help strengthen up those pelvic muscles, so that we can hold our urine and also not prevent incontinence. The urethra transports urine from the bladder to the outside world. Now, men are at a greater risk for retention in their old age related to a reproductive problem. It is your prostatic hypertrophy. Again, prostatic hypertrophy. And so essentially what happens, the prostate swells with age. It swells around that urethra. Here we go. Here's a good picture. The prostate, and here you go. This is normal, and this is abnormal. And so with age, that prostate enlarges. It starts swelling. And as it swells, it's swelling around that urethra, causing it, making it harder for the urine to leave the bladder. Luckily, there are some, of course, medications for this, and you've probably seen them on TV advertised. Some of the medications for BPH, this is BPH, are Flomax. That's, I believe, the trade name. The generic name is tamsulosin. We also have brand name Proscar, and its generic name is finasteride, Finasteride. And then another brand name is Avodart, and the trade name for that is, I'll just spell it for you. It's kind of odd looking word. Dutastericl. And these do contain hormones, so you have to be very, very careful if you're female and you are passing this medicine. Women are not supposed to touch this tablet. We're not supposed to touch any tablet. However, this is especially important for pregnant women not to handle this drug. They should always wear gloves. Now, another treatment option, and initially, oftentimes doctors will put them on a medication, and over time, again, medication either doesn't work, or they may have, just with age, it just kind of keeps getting worse. So they can do a surgery called a TURP, capital T, capital U, capital R, capital P, and that stands for transurethral resection of the prostate for benign hypertrophy. And so after surgery, the patient will have what's called a CBI, and that is a continuous bladder irrigation. And with the irrigation, it is to prevent blood clots, because if we get a blood clot, then the bladder irrigation just stops. And so we do not want a blood clot in that system, because it can't heal properly if we have a blood clot. The continuous bladder irrigation helps heal the prostate, and so we need that irrigation for that. And if if a blood clot does get in the way, nurses do something called bladder irrigation, and they use a 60 cc Toomey syringe, that big syringe like you use for peg tubes. They put sterile solution in that, and they irrigate that bladder to remove that clot. So keep that in mind. And I also have a video for you on this slide. I'll try to remember and put all the videos on a file and put it in embedded in your unit as well. Okay, and here is a picture of the irrigation. And this, what's going up inside the patient, it's a three-way Foley. Essentially looks like a three-way Foley, because you have the solution that's going in, and I say three-way because you have 1, 2, 3 ports here. One port goes into this tube, the irrigation, and goes into the bladder to irrigate. And as if there's no clots, the irrigation will come out this tube and go into a bag. Now, these irrigation bags are big, and depending on how fast the rate is going in, initially they're very fast, because they definitely want to keep that bladder emptied. And if you are the nurse for this patient, you will be in this room at least once an hour, emptying this and recording output, and putting a new bag of this. This is irrigation solution, and so again, recording input here, output here. Now, if the bladder forms a clot, your irrigation is going to be through this port here. Again, irrigation through a 60 cc or ml syringe with sterile solution to irrigate. And the irrigation is a push pause. You kind of put a little in and pull it out, pull it in and pull it out, pull it in, pull it out. You have to be very careful. And when you're doing this, also be sure that you are wearing a mask and a isolation gown, because it's kind of tricky to hold it and irrigate at the same time. And so it's very easy to accidentally pull the syringe out and some of that solution fly on you, the patient, so forth. So again, you'll want to have gloves, a gown, and a mask that has a face shield, so you don't get it, into your eyes or on your face.